actually take your fingers and place them in between your toes. All right? Some of you can maybe just get a little bit, but right?
It's hard.
It's hard, right? My wife hates this at night. She's a school nurse, and every night
She hates it?
She hates it because it's so tight in there. If she wears her shoes, I mean, my wife is the worst patient that I have.
We won't
Listen, anyway.
we
What's
won't
it?
get back to her. We
I
won't
should-
get back to
Yeah,
her.
okay, thanks.
I should. I know. I should delete that part.
So what? Yeah, right. So what you want to do in this position is clockwise. Okay.
Yeah.
And I mean, you want to grab. If you want me to show you guys how to do it, I'll put my fingers in your toes. Right, and then counterclockwise.
Because this does what? Warms up the ankle?
Warms up the what's called the intrinsic muscles in between. Yeah.
Oh.
So you have little muscles on either side of these toes, right? And they never get worked. Right? So it's warming it up, but it's also breaking up. What we get is adhesions or knots, right, in the pad of the foot, because you technically have 3 arches in the feet. You have a medial longitudinal arch, which creates basically your main arch. You have a lateral longitudinal arch, and then you have a transverse arch. For most people, they're all collapsed. Okay? And what I tell patients is the more you do this, the more you'll find that when you actually walk around, you're going to be able to actually grip the ground naturally. So when you have things like hammer toe, what happens is your body's instinctively saying, hey, I don't know where the ground is, so I'm going to hammer. Right? And the more you do that, you start to change the anatomy, and so your body will respond. The way bone responds, it's an inflammatory response, is it actually puts down more bone. Because that's how, when I see arthritis in the body, that's either too much movement in that joint, or your body says there's not enough movement, so this is going to be the new default setting. So lack of movement, that range of motion in any part of the body is a telltale sign that that joint will become arthritic if we don't do anything about it, right? And so as you move the muscles in your calf actually acts as a pump. So think about it this way. Physiologically, when you're standing or sitting, your calf is the furthest point away from your toes, right? So if you talk to podiatrists, and when they talk to patients that are diabetic, you can almost look at their skin and the tone and figure out what's going on. Because by the time you have toxic blood and it gets to your toes, there's something else going on, right? So your calf has 3 parts, right? So you have this big muscle that you can see, right? This you call your gastrocnemius. But people realize there's a little muscle underneath that they don't see. That's called your soleus. All right, so that what we say in chiro school is the big muscle, the gastroc, is for show, and the little one is to go. All right? That little one is your pump. It is your active pump. Hence, if you have a Fitbit or something, it makes you get up every 20 to 30 minutes. Why? Because the pump starts to shut off. Right? So I always tell patients, I go, when you sit for more than 20 minutes, you effectively have created so much pressure in the calf that you can cause edema. That's why if you're in a hospital setting or if you had any kind of surgery, you wear compression stockings, right? That's to effectively push the fluid back up. Okay? Arterial blood is forced through the heart to the body. The venous blood, or that lymph, is really the only way it comes back up is through muscular contractions. So if you sit for too long, what it does is it starts to pool. But when it starts to pool, it starts to change how your nervous system functions, right? So those nerves can't function at 100%. So what happens is you start to lose connection with your foot. And over time, you think that's normal, right? And that's typically what I notice is when I start adjusting people's feet, they start to get warm, okay? And as they get warm, what it does is it starts to nourish this big plantar fascia right there. Does anyone have a cross ball at home?